Your mouth is dry right now, not because you're thirsty, not because it's hot outside, because something in your body is quietly failing. And the scary part is, your doctor probably doesn't know it yet. In the next few minutes, I'm going to show you 5 things your dry mouth is actually telling you, things that, if you miss them, can land you in the hospital within the next 2 years. Stay with me. This is one of the most important things you'll hear all year. My name is Dr. Isabel Greer. I've spent more than 10 years working exclusively with adults over 60, and I can tell you this without hesitation. Dry mouth is the most underestimated warning sign I see in my clinic. Every single week, most people brush it off. They drink a glass of water and move on. But the research tells a completely different story, and today, I'm going to share it with you in plain language. By the end of this video, you'll know exactly what your dry mouth is hiding, which combinations of medications are making it worse, and the specific words to say to your doctor to finally get the answers you deserve. Before we go any further, everything I share here is for educational purposes only. This video is not a substitute for medical advice. Always speak with your own doctor before making any changes to your medications or your health routine. What I'm giving you today is information. What you do with it is a conversation to have with your physician. Now, let's get into it. Most people think saliva is just there to help you chew your food. That's like saying the immune system is just there to help you fight colds. Saliva is one of the most complex fluids your body makes. It contains over 700 proteins, enzymes, and antimicrobial compounds. It's your mouth's immune system. It's the lining that protects your throat. It's the ignition switch for your entire digestive process. When saliva disappears, none of those things happen correctly. Here's a simple way to think about it. Imagine your mouth as a castle. Saliva is the moat. When the moat dries up, there's nothing stopping the bacteria from walking straight through the front gate and into your bloodstream, your lungs, your heart. A 2021 study out of UCSF followed over 12,000 seniors and found something that should make everyone pay attention. Adults over 60 with confirmed dry mouth were nearly 3 times more likely to be hospitalized for a respiratory infection within 2 years. 3 times. For a symptom most people never even mention to their doctor. Let me tell you about a patient I'll call Dorothy. She was 73, sharp as a tack, active. She came to see me not about her dry mouth. She had actually never mentioned it to anyone. But because she'd had 2 chest infections in a single year, 2 rounds of antibiotics, she felt like she just couldn't shake it. When I asked her about her mornings, she mentioned almost in passing that she always woke up with a completely dry mouth. Had for about a year, just kept water on the nightstand, figured it was normal. It wasn't. Every night while she slept, bacteria from her unprotected mouth were being inhaled into her lungs in tiny amounts. This is called microaspiration. In a healthy mouth, saliva catches those bacteria before they travel anywhere. Dorothy's mouth had no saliva, no moat, no protection. We identified the cause. We treated it. Her chest infections stopped completely. But here's the question I want you sitting with right now. How long has your mouth been dry in the morning? Just think about that number. Drop your answer in the comments. Yes or no. Do you wake up with a dry mouth? You might be surprised how many people watching right now have never once said this out loud. This is the one that makes me angry, because it is completely 100% preventable. Over 500 medications commonly prescribed to adults over 60 list dry mouth as a side effect. Blood pressure pills, antidepressants, antihistamines, bladder control drugs, diuretics, sleep aids. Here's the part that nobody explains at the pharmacy counter. When you take 3 or more of these medications together, the effect doesn't just add up, it multiplies. A 2023 study published in the Journal of the American Dental Association found that 3 xerogenic medications, that's the medical word for drugs that dry out your mouth, don't cause 3 times the dryness. They can cause 6, 7, or 8 times the salivary gland suppression, 6 to 8 times, from medications you've probably been taking for years. I had a patient, I'll call him George, 71 years old, retired, healthy diet, walked every morning. He came in because his dentist had found 7 teeth destroyed by decay in less than a year. 7. His dentist had only ever seen damage like that in patients who had undergone radiation to the head and neck. When we looked at his medication list, the answer was right there. A blood pressure medication, an allergy pill he took every single day without thinking, a bladder drug his urologist had prescribed 2 years earlier. All 3 belonged to a class called anticholinergics. All three were suppressing his saliva. Together, the damage they were doing was exponential. His medications were reviewed, 2 were adjusted, 1 was replaced with a non-anticholinergic alternative. Within 8 weeks, his mouth was producing saliva again. Here's what I want you to do right now, not tomorrow, right now. Write down every medication you take, every single one, including over-the-counter. Then, the next time you see your doctor, say these exact words. I'd like a formal polypharmacy review focused on my combined anticholinergic burden. That phrase, polypharmacy review, anticholinergic burden, will change the conversation in that office. I promise you. How many medications are you currently taking? Type the number in the comments and keep watching, because point 3 is the one that surprises every single patient I share it with. This is the one nobody sees coming. Dry mouth causes malnutrition, even when you're eating normally. Let me explain why, because this is not obvious. Saliva does something most people don't realize. It sends a chemical signal to your stomach to prepare for digestion. It starts breaking down carbohydrates before the food even reaches your stomach. It's the starter gun for your entire digestive process. When saliva is absent, that starter gun never fires. Your stomach isn't ready. Your digestive enzymes don't activate properly. Nutrients pass through your system without being absorbed the way they should be. Think of it like this. Imagine trying to start a car without a key. The engine is there, the fuel is there, but without that first signal, nothing moves. A 2022 study from the Mayo Clinic looked at seniors diagnosed with unexplained malnutrition, people whose doctors couldn't figure out why they were losing weight or muscle mass despite eating regularly. 44% of them had clinically significant dry mouth that had never been identified as a contributing factor, nearly half. I've seen this in my own practice more times than I can count. A woman in her late 60s, eating well by every measure, still slowly losing weight. A man who complained of fatigue and muscle weakness despite a normal diet. In case after case, once we addressed the dry mouth, absorption improved, weight stabilized, energy came back. The symptom you thought was minor was quietly dismantling your body's ability to feed itself. Stick with me. Points 4 and 5 are where we get into the 7 specific warning signals you absolutely need to know. And the list at the end could change a conversation you have with your doctor this week. Your mouth is home to roughly 700 species of bacteria. Under normal circumstances, saliva keeps that ecosystem in balance. The dangerous bacteria stay controlled. The helpful ones thrive. When saliva disappears, that balance collapses. The dangerous bacteria, Streptococcus mutans, Porphyromonas gingivalis, surge within weeks. And here's the part that is genuinely frightening. They don't stay in your mouth. According to research published in Nature Reviews Microbiology in 2023, these bacteria enter your bloodstream through tiny breaks in your gum tissue, breaks so small you'd never feel them, and they travel. They've been directly linked to heart valve infections, to worsening diabetes, to accelerated cognitive decline, to sepsis. A 2023 Johns Hopkins study of over 8,000 men aged 65 to 75 found that elevated levels of oral Streptococcus mutans were associated with a 34% increased risk of a major cardiac event within 18 months, 34%. From bacteria that started in a dry mouth? I want to be direct with you, because that's how I work. If you've been dismissing dry mouth as a nuisance, this is the point where I need you to stop dismissing it. This is not about discomfort. This is about what happens inside your body when that discomfort is left unaddressed for months or years. The good news, and there is good news, is that once the cause is identified and treated, the bacterial surge reverses. Your oral ecosystem can rebalance. The cascade stops. But only if you catch it. This is what you came for. Take notes. Signal 1. Ammonia or metallic smell with your dry mouth in the morning. This is not just bad breath. A chemical or metallic odor coming from a dry mouth can indicate a kidney function problem. Ask your doctor for a kidney function panel. Signal 2. Saliva that feels thick, ropey, or foamy. Not absent, just wrong. This is different from a completely dry mouth. Altered saliva texture is often an autoimmune signal. Sjogren's syndrome, lupus, and rheumatoid arthritis all present this way. Ask for autoimmune screening. Signal 3. Dry mouth only at night, but fine during the day. This specific pattern, morning dryness, normal daytime saliva, is a sleep apnea marker. Your airway is collapsing during sleep and forcing mouth breathing for hours. Get a sleep study. This is treatable. Signal 4. Dry mouth plus waking up frequently to urinate. This combination is a diabetes red flag. High blood sugar pulls water from every tissue in your body, including your salivary glands, while simultaneously increasing urinary output. Request a fasting glucose test and an HbA1c. Don't wait. Signal 5. Dry mouth plus dry, gritty, or burning eyes. This is the hallmark presentation of Sjogren's syndrome, which affects an estimated 1 in 70 women over the age of 60. It is dramatically underdiagnosed and it is treatable, but if missed, it can progress to the kidneys, lungs, and nervous system. Mention both symptoms to your doctor in the same breath. Signal 6. Dry mouth plus leg cramps or foot cramps, especially at night. This combination points to a serious electrolyte imbalance. Low sodium, low potassium, low magnesium. Especially dangerous if you take diuretics. An electrolyte crisis combined with dry mouth can trigger cardiac arrhythmia. Call your doctor this week, not next month, this week. Signal 7. Dry mouth that started within 90 days of a new medication. The 90-day window is when anticholinergic suppression from a new drug reaches its full clinical threshold. If your dry mouth started around the same time as a new prescription, that is not a coincidence. You need a polypharmacy review. Go back to those exact words I gave you in point 2. Which of those 7 signals sounds familiar to you? Type the number in the comments. The more people share, the more clearly we can all see how common this actually is. I'm not going to leave you with just a list of problems. Here's what to actually do. Step 1. The morning assessment. Before you drink anything tomorrow morning, pause for 60 seconds. Is there saliva in your mouth? Is it thin or thick? Any chemical smell? Can you swallow without water? Do this every morning and write it down. That data is exactly what your doctor needs. Step 2. The medication audit. List every medication you take, prescription and over-the-counter. Check each one for the words anticholinergic or xerogenic. Then bring that list to your doctor and say, I'd like a formal polypharmacy review focused on my combined anticholinergic burden. Step 3. Stop reaching for plain water. Water does not fix dry mouth. I know that sounds strange, but dry mouth is a glandular function problem, not a hydration problem. Your salivary glands need electrolytes, sodium, potassium, bicarbonate, to produce saliva. Plain water dilutes those electrolytes further. Small sips throughout the day, paired with electrolyte-rich foods, works far better than a glass at bedtime. Step 4. Protect yourself at night. Elevate the head of your bed 4 to 6 inches using bed risers, not extra pillows, which can strain your neck. Run a cool mist humidifier at 40 to 60% humidity. Use a xylitol-based mouth rinse immediately before sleep. Never alcohol-based. Alcohol dries the mouth further. Step 5. Know the emergency signs. Dry mouth with difficulty breathing. Emergency room now. White patches in your mouth. Call your doctor today. This is oral candidiasis. Dry mouth with sudden confusion or weakness. Call 911. Dry mouth with chest pain or rapid heartbeat. Call 911. These are not wait-and-see situations. Let me pull this together quickly. Saliva is your body's immune shield, digestive trigger, and bacterial checkpoint, all at once. More than 500 medications can suppress saliva production, and combining 3 or more multiplies the damage dramatically. Dry mouth can cause malnutrition even when you're eating full meals every day. Oral bacteria from a dry mouth can reach your heart, lungs, and brain. 7 specific signals, from ammonia breath to nighttime leg cramps, each point to a different underlying condition your doctor needs to know about. These are not small things, they are not part of normal aging, and they are absolutely not something you have to live with untreated. If this was useful to you, please hit subscribe. I'm Dr. Isabel Greer, and I post new videos every week, always based on real research, always in plain language, always focused on what actually matters for adults over 60. No fluff, no filler, just answers. And before you close this, share it. One person, someone over 60 in your life who wakes up with a dry mouth and has never once mentioned it to their doctor. You might be handing them something that genuinely changes their health. The next video is already up. Go watch it. I'll see you there.